How far into pregnancy should a pregnant woman work? There have been no guidelines up to now. A special counsel of the AMA says that despite the fact that many pregnant women want to work right up to the end, it's a risk in some situations. There's been little research done on what the effects of an 8-hour workday might be on a mother-to-be. The decision about when to quit is basically left up to the working woman. At the Shackley Corporation, we found 2 expectant workers with 2 different notions about how much time off before delivery would be enough.
If my doctor revises my due date, obviously I'm not going to be working the day of labor, but I'd like to work as long as possible, given we have a 3-month maternity leave and I want to spend as much time with my baby rather than sitting at home waiting for something to start.
Well, I decided I would stay on until a month prior to delivery date. I've seen a lot of pregnant women that unfortunately have to stay on until the last minute, and they really suffer at that last month coming to work. They're tired. It's a strain on the employee as well as the boss, I think.
The new AMA study says the 2 women are both right. Secretaries or managers can safely spend all 40 weeks of their pregnancy on the job. So can others with jobs that have light physical demands. But if the job requires standing more than 4 hours a day, they say you should stop 6 months into pregnancy. How about stooping below the knee level more than twice an hour? The guidelines say stop 7 months into pregnancy. Heavy lifting or climbing should end at 5 months. Dr. Robert Power of Children's Hospital in San Francisco says the guidelines might seem conservative, but there's good reason for an obstetrician to advise a patient to get off her feet.
A job that demands an upright position would normally decrease the blood flow to the uterus. Prolonged standing or even prolonged sitting.
The key to staying on the job late into pregnancy is getting enough rest. Take the breaks you've got coming, and don't let fatigue take over your life. And the real problem is women wanting to work right up to the end so they can have more time with their baby. And the AMA, of course, is simply urging more flexible work rules, for instance, to allow shifting a pregnant woman in the last trimester to a less strenuous job if necessary. Well, when the childbearing years are done, of course, all women go through the menopause. Researchers today at the American College of Obstetrics and Gynecology